Senator Roberts.
Thank you, Chair. Thank you for attending today. Going to the government's COVID-19 response inquiry, the panel only talked to people who volunteered to talk to it, didn't they?
Senator, there was no compulsion. People weren't compelled to talk to it.
You must be a mind reader. That was my next question. And there was an inquiry that had no ability to compel witnesses, order for documents and take evidence under oath, correct?
That's correct.
Thank you. The then government put in place the largest economic response in history, dropping money from helicopters. We had some of the worst invasions of Australian civil liberties between surveillance, vaccine mandates and lockdowns. The supposed health advice relied on to do this has still not been published, yet Australians are meant to just accept the results of an inquiry that can't even take evidence under oath. Is that right?
Senator, the inquiry had excellent cooperation from a wide range of people. They spoke to nearly all state premiers who were premiers at the time of COVID. They spoke to nearly all the chief health officers. They spoke to groups representing people impacted by the pandemic in particular ways. For example, aged care groups, people with disabilities, called groups. They spoke to and received submissions from people who were not supportive of the use of vaccines, etc. So they received evidence from and spoke to a really wide range of people. And their report reflects a really broad set of views that were put to them, and they have assessed those and made some recommendations in relation to them. And the government is now considering those recommendations.
Thank you. Minister, I had the opportunity to listen to Minister Butler, the Health Minister, discuss the report, and he said there was a lack of transparency on rationale and evidence around decisions that had profound impact on people's lives and freedoms. He said that there was a lack of a shift from precautionary principle at the start of the response to the COVID virus, which we accept, but there's a lack of a shift from precautionary to evidence-based. It never occurred. There's no balancing of risks and benefits. There's no taking account of non-health impacts of decisions imposed on the community and in a non-proportionate way. He said this was compelling insight from this report, a lack of evidence-based policy, yet we were told repeatedly at state and federal level this is all based on evidence. The evidence changed from day to day, week to week, within states and certainly between states. We were lied to. We were lied to. There's a lack of transparency, as the Minister admits. And then he said it's driven a large decline in trust so that the measures are not likely to be accepted again. This is a serious problem. Health departments across the country are in tatters. Yet there's no recommendation in this report which says we shouldn't establish a Royal Commission, correct?
That's correct.
How are we going to restore accountability, Minister, and trust without actually holding people accountable for the tragic errors they made?
I think the point that, well, first, I think there's been this was a very comprehensive inquiry into, the multifaceted aspects of Australia's response. And obviously, whilst I'm not the minister responsible, obviously it was something we considered, and I think it's a very good piece of work that is very honest about the things that Australia did very well, and we did do some things extraordinarily well, and we didn't see the sort of overwhelming of hospital systems and the death toll that we saw in some other developed countries. But there are also things which we didn't do as well, and there were things which we weren't set up to do. Now, I suppose where we differ from you in terms of the last part of your question, Senator Roberts, is that we do want we want to learn from this in a constructive way rather than in a way that we want to be constructive about the failings as opposed to simply pursuing those who might have made the errors. I think that the inquiry does go through in a lot of detail, as you said, the precautionary response. I think there's a question about whether some of the findings about what was evidence-based or partially evidence-based is perhaps not as black and white as your question suggests.
I'm paraphrasing the Minister.
Yeah, of course. But you know, that's a matter for discussion. I think it's also true to say that you don't get a global pandemic of that ilk very often in most people's lifetimes, and so understandably you are going to make mistakes as a nation as well as do things right, and I think that's what the inquiry shows. And the Minister sorry.
Oh, sorry, you continue.
No, I was just going to say I think the Minister's been clear about we need to learn from this, and the CDC, that's what we called it in the end, the Centre for Disease Control was obviously one of the key recommendations which the government responded to.
Thank you. The then Prime Minister and the Premier of my state, our state, Premier Palaszczuk, I wrote to them, I said, we'll give you a fair go in the Senate. I said that with their response in March, then the second response in April, job keeper, job safe, and then job keeper. And then I told them I would hold them accountable. I wrote letters to the Premier and the Prime Minister in May. And I also wrote, and I got no evidence back at all. Then I wrote to them again in August, September. Again, no evidence. I was seeking evidence. The Chief Medical Officer gave me evidence in March of 2023 saying that the severity of COVID was low to moderate. That, when you figure in the overwhelming majority of people, it was very, very low when you remove the people who were at high severity. We did this all for a low severity virus. There was no pandemic of deaths, so we're expecting Australians who've lost trust in the health system, see no accountability, to just accept it. This is dancing away from responsibility and accountability in the health system.
Yeah, well, I don't think there's been any move. I think it's a very accountable report with respect, Senator Roberts. I mean, it's, many hundreds of pages, which go through in great detail a lot of the aspects of the nation's response to the pandemic, Commonwealth government, Commonwealth state territory, the medical sector, how we handled borders, how we handled hospitals, the community sector. Look, I think it is a very comprehensive report, so I don't know that I agree with the assertion about a lack of accountability. I also would say to you the evidence, if you want to talk about the evidence base, I don't think the evidence supports the proposition that this was simply a low, what I can't recall the phrase you used, was it a low
to moderate severity?
Well, Senator, I mean, I don't share the view of some who say that it was
That was the Chief Medical Officer.
I don't share the view of some that look to what happened in the US, what happened in Italy, what happened in Spain, in terms of what we saw there and the hospital systems and the consequent rates of death. I don't think I don't dismiss those as made-up news, and I think the fact that we averted that kind of scenario in Australia is something we should reflect upon.
Well, I agree.
And, you and I had different views on the vaccines. But I think what I'd say to you is I hope it can be there were mistakes made. Yes, people have to accept that, front up for that. But I hope we can actually use this to make sure we equip the country better. Because given a more globalised world, what we know from most of the experts, WHO, our own experts, is pandemics have become more likely. Obviously,
Let's go to New Zealand, because New Zealand,
close their border.
we had a Senate inquiry as a result of a motion that I moved in the Senate. That developed the terms of reference for a possible future Royal Commission. The terms of reference are wonderfully comprehensive. Nothing's been done. The Prime Minister won't even share them with the people. The terms of reference are so comprehensive that they were adopted largely by the New Zealand Royal Commission. The New Zealand Royal Commission that was underway thanks to Jacinda Ardern was a sham. It had one commissioner, very limited terms of reference. The terms of reference that were developed by the Senate committee in this country are now adopted by the New Zealand Royal Commission. They've expanded it to 3 commissioners. And that came about because Winston Peters, who initially was in an alliance with a coalition with the Labor Prime Minister Jacinda Ardern, went and listened to the people in Wellington at a large protest. And he realised that so many people had died due to the vaccines, and so many people were crippled due to the vaccines. And he also realised that so many people were gaslit, saying it's not a vaccine injury, it's just a mental health issue. He then formed a coalition with the current National Party government, and the condition was that they have a proper fair income Royal Commission. The terms of reference have been expanded, broadened and extended and detailed, and they've now brought vaccines into that and also vaccine injuries into that. Isn't that the least that we can do for the people who have been injured? Tens of thousands have died as a result of the vaccines. We know that from the statistics and the correlation. We also know that hundreds of thousands have been seriously injured. And they're just being laughed at. No health department in this country.
Senator
Why
Roberts,
can't
I
we
don't
get
think
justice for those people?
that's a question. I don't think that's a question.
I just asked a question.
I'll try and... I mean, I think if you want details about vaccines, probably health would be the place to go in terms of the estimates process.
Oh, we're going there, Minister.
I'm sure you will. In fact, I think you regularly do, Senator Roberts. I'd make an observation, which is, I know you don't accept the medical evidence, but that is the medical evidence both governments have received.
Contrary, Minister, I do accept the medical evidence.
Well, okay. I don't think you do accept the weight of the medical evidence. The second is, I am concerned, and I think the inquiry might have gone to this. You know, we've had a pretty good history in this country of vaccination across, measles, whooping cough, etc. And the concern about vaccines means that we are dropping close to below herd immunity.
Yeah, we are. Yeah.
Below herd immunity for diseases which we had largely won the battle against, and I don't think that is a responsible thing to do. So
that's another matter altogether.
But Senator Roberts, I just would say we do have a responsibility in this place to understand where our words land, and I don't think it's a good thing if we're not vaccinated against whooping cough or measles or frankly COVID.
The fact is that people were getting vaccinated or vaccinating their children for whooping cough and so on. The fact is that they have lost complete trust in the health system, so many people, and they're saying stick your vaccines.
Yes,
and that's why it's so important. How will you restore accountability?
Well, how will you, Senator? Because, if you said to them, you should get your kids vaccinated for whooping cough, that might actually cut through.
I've done some research on that.
Oh, you don't want them vaccinated?
I didn't say that. It should be the parents' choice.
You see, I disagree with you. I mean, I just think that the medical parents' choice, parents always choose, in terms of medical treatment for their children, but I disagree with you that people can choose their facts. I mean, the facts are we know what whooping cough does.
I think it's fundamental.
No, it does to kids.
It's fundamental.
All right.
That parents have responsibility for the health of their children. That is fundamental.
Fair enough. Okay, we're going to disagree on this, on the issue of vaccinations.
Senator Sheldon.
One last question, Chair.
Oh, okay. Last question, and then Senator Sheldon has the call.
The Australian people deserve transparency and answers. They deserve a COVID Royal Commission now, and some people deserve to be in jail for the overreach and damage inflicted on Australians. How is your government going to restore trust without accountability?
I think we've just been discussing this, haven't we?
Yeah, I raised it earlier on, but you didn't answer the question.
Which bit do you want? We don't think we need a Royal Commission because we've had a...
How can you restore...
Well, I'm inviting you to help us
accountability?
restore trust, Senator Roberts, but you don't want to... You don't agree with many of the vaccinations. I mean, my point is...
No, I didn't say that.
That is what you said. That is what you said. You had your own views on whooping cough.
Parents have the right to choose what to do. Parents are responsible for their children. That's
but they are
fundamental.
also... Yes, that is true. But I disagree that... What I mean was parents should not be given incorrect facts by people in the positions of authority.
I agree entirely.
Well, I'm actually saying to you that I think it is not responsible to be telling people that they shouldn't have their children vaccinated for whooping
I didn't
cough.
say that. I said the parent's choice. I recommend a book, Fooling Ourselves, written by a statistician in Queensland. That's evidence. So I give that to parents and say, decide for yourself.
Right, so you don't think the medical evidence and...
This is the medical evidence.
Well, that is... Okay.
Thank you, Senator Roberts.
Can't deny
We'll now move on. You did say that was your last question. Senator Sheldon.